Good evening. Thank you for coming here today. My name is Natalia Zdziechowicz. I study applied psychology. And first, I want to tell you a short story. Last summer, I was hitchhiking through the Balkans. It was 8th day of my trip. I decided to stay for a few days in a city called Mostar in Bosnia and Herzegovina. The weather was really nice. Food was delicious. The city was beautiful. And people were very kind and helpful. But there was a problem. I was sleeping on the street because I couldn't pitch my tent. Why? Because nowadays in Bosnia and Herzegovina, bombs are still scratched everywhere. And this is the topic of my presentation for today: post-traumatic stress disorder in Bosnia and Herzegovina. Would you imagine that in this marvelous and peaceful place could be a civilian war 24 years ago? This is the plan of my presentation. I will start with a history of war in Bosnia and Herzegovina. Then I will tell you something about PTSD. And after that, I will focus on PTSD in Bosnia and Herzegovina. And finally, I will tell how psychologists deal with PTSD in Bosnia and Herzegovina and why is it important to talk about it. War in Bosnia and Herzegovina was part of the breakup of Yugoslavia. In 1991, Slovenia and Croatia decided to secede from Yugoslavia. Also, Bosnia wanted to be an independent country. In 1992, they tried to make a referendum for independence. However, there was one issue. Bosnia was inhabited mainly by Muslim Bosniaks, but also by Orthodox Serbs and Christian Croats. So Serbs boycotted the referendum and war started. 100,000 people were killed during this war. Over 2.2 million people were displaced, and we still don't know about 8,000 people. Those terms are related to the war in Bosnia and Herzegovina. Ethnic cleansing means that Serbs tried to destroy the whole group of Bosniaks. They destroyed the holy places, houses, and cities. Genocide in Srebrenica. Serbs murdered 8,000 people there. Most of them were children and the elderly. Not only women in Bosnia were raped, also children and men. In concentration camps, prisoners were forced to rape other prisoners. There are also a lot of cemeteries in Bosnia, and we can see them everywhere. So what is PTSD? Those are the criteria for it. First, person was exposed to death or threatened death or serious injury. After that, there are intrusion symptoms such as negative feelings, upsetting memories, also flashbacks and nightmares. Then there are also negative feelings and negative assumption about world and oneself. There are also problems with aggression and irritability, and the person has problems with concentration and sleeping. Duration, symptoms for more than 1 month. They also have big impact for occupational or social life. And of course, they are not due to illnesses or other illnesses or medications. Why are we safe where others are not? Why am I still alive when all my family is dead? This is the main question which people with PTSD ask. nowadays in Bosnia and Herzegovina, young people have problems with alcohol, drugs, also with suicides, with unemployment. They just don't see their, they just don't believe that something has this sense. And there is also the stigma of PTSD. If you talk about your feelings, if you talk about that you don't feel well with what happened, you just can be seen as a weaker. And how? You just can't have PTSD if you're just walking around and see destroyed buildings because Bosnia's government does not do anything with them. How they try to deal with PTSD? They use medicines, but most of them, they just work for a few symptoms. They also use psychotherapy. There are psychotherapy groups for children. They use art for them. There's also psychotherapy groups for women, rape women, and also for men. But the main problem is that we don't have official data about it. The psychotherapy works, even after 24 years ago. They use also meditation and biological therapy. And we can see the part of Bosnia called Republika Srpska on the map. And they don't allow to PTSD exist in this part. Just PTSD does not exist there because it is not allowed. There is also optimistic point of view. We can see that more and more people were treated for PTSD just after the war in one of the biggest cities in Bosnia called Tuzla. But I need to mention 3 main problems with PTSD there. There's lack of funding. As we know, Bosnia is really poor country. If you don't have money for basic needs, how you just can find the money for a psychologist? And there's also the lack of professionals. There are not the young people who are well educated, they just emigrate to the Western countries. So there are not a lot of psychologists there. There is also a problem with paraprofessionals, such as religious leaders or family members. They don't know how to deal with PTSD, but they try to do it, but wrongly. And there is also the lack of education. People don't know that PTSD exists. They don't recognize the symptoms of it. So they are all the time sick. And to sum up, I just want to tell why is it important to talk about it nowadays, because it was 24 years ago. Because now, war is still happening. For example, in Ukraine or in Syria. If we know this, and we have this knowledge, why we just don't stop it? And to sum up, I just want to ask you, think about where you are during your holidays. Just look around you, talk with people, just try to know more about this country, and just don't focus on the perfect photos for Instagram or the delicious food. Focus on where you really are, and that's the important thing for me. Thank you.